Hi, I'm Jackie Andraka with The Scoop, and we're here with Dr. Loren Riskin, who is based here at Stanford University. And so you gave a great talk about patient safety and how we can use technology to do that. And so tell us a bit about your work.
So as you mentioned, I'm here at Stanford. I'm an anesthesiologist. Our talk yesterday focused on emerging trends in patient safety. So there are a number of new focuses on using existing technologies and revamping clinical informatics to create safer patient systems. In essence, the overall goal of patient safety is to make it really easy for the clinician to do the right thing and hard to do the wrong thing. Mm-hmm. Because the goal, as Atul Gawande said, isn't how to stop bad doctors from harming patients, but how to stop good ones from inadvertently harming patients.
And so what technologies are you using to make sure that these good doctors won't accidentally hurt a patient?
So a lot of it comes down to workflow design. So there are a couple different initiatives both here, and some of the panelists who joined us were from Kaiser Permanente. Different features in our anesthesia information management systems, early modified warning systems that allow us to promptly pick up on certain trends that may be signs that a patient may be decompensating soon, certain ways that our records can kind of help feed back on us and make sure that we catch things early or do things in a reasonable manner. Clinical decision support is kind of this growing field as well. We also had a wonderful visit from Keith Ruskin, who's an anesthesiologist at Yale. He spoke a bit on using a national outcomes registry in anesthesia to better identify some of the trends among providers that aren't easily readily apparent without looking at the big picture, big data overview.
Awesome. And so are you using this technology and programs only here at Stanford, or are you expanding them to a bunch of different other hospitals?
So different programs are used in different ways. So some of the early modified warning systems work has been rolled out throughout Northern California Kaisers. Here at Stanford, we've spent some time making sure that our information management system workflows help guide the clinician in an appropriate manner. The National Outcomes Registry that I mentioned now has something like 20 million anesthetic records across the country.
Wow.
So all of these different projects in development are in very different phases of rollout.
Now, what advice would you have for a doctor who is a bit worried that they might inadvertently harm their patient, but they want to take all the precautions they can? What one piece of advice or what change would they want to make?
Communicate. Sometimes we talk about patient safety like a hockey team. Why would you play a man down? Yeah. Get everybody involved, and the more clear communication, the more willingness to really listen to the patient and their family, the happier we all are in many ways.
And what is the most promising thing you see for patient safety?
More education. It's actually becoming a field of rigorous scientific study. It's really coming into its own. And I think that as we have conferences like this, as we open those lines of communication, I find it amazingly encouraging that we now have, physician fellowship training in the field, that we now have amazingly empowered patient communities. I'm pretty hopeful.
Thank you so much for your time.
All right, thanks.
For The Scoop, I'm Jackie Andraka.